the ankle fusion. But what happens when it goes wrong? And I think, now, and we'll see it in the next session, ankle arthroplasty is becoming so prevalent now that I think you're going to see these less and less, and they're already rare cases. So I think seeing ankle fusion malunion is going to become rare, but something still that you need to know about just to fix them when they come around. So for the most part, like we heard, ankle fusions have relatively good outcomes. And a lot of this depends on the mobility of the adjacent joints. And really for the right patient, again, younger patients, more active patients, post-traumatic, young people, you're going to do an ankle fusion for them. And there's multiple different techniques, like we just heard. You can do open versus arthroscopic. You can use plates, screws, lots of different fixation techniques. So, like I said, these are uncommon, and I think you're going to see less and less of these already. So, what's the best way to treat the ankle fusion malunions? Well, I mean, really the treatment is to avoid the malunion. Don't create one. And so what's the optimal position for fusion? Again, neutral dorsiflexion, about 0 to 5 degrees of valgus, 5 to 10 degrees of external rotation, neutral translation. And so when you look at these, the most common malunion is equinus and varus, and sometimes they can be combined deformities, which are definitely harder to treat. And this is not really, like any rigid deformity, this is not something that they tolerate well. So again, respect the fibula. So non-union after fibular removal, if you get these, you'll see that the ankle just drifts into valgus malalignment, and then that compromises your subtalar joint. And a lot of times that will create arthritis there, and it's something that you now